Having your pregnancy labeled as high risk can be frightening, but it doesn't need to be. In the medical world, this term simply means that there is something about your pregnancy that makes it different from a routine pregnancy and delivery. The term high risk is used in a large range of circumstances, ranging from just needing a few extra tests beyond what is typically routine, to a pregnancy that requires a very high level of care. This video will cover some important questions to consider if you are told your pregnancy is high risk. First, ask your provider to clearly explain the risk, as well as the possible clinical impact that this could have to your pregnancy. If you have a history of kidney disease, severe autoimmune disease, organ transplant, complicated diabetes, complicated abdominal surgical history, or multifetal gestation, such as twins or triplets, these are some of the reasons why your pregnancy might be considered high risk. An MFM, maternal fetal medicine specialist, also known as a high-risk obstetrician or perinatologist, is someone who has trained for an additional 3-year fellowship after their OBGYN residency. That way they can care for women with very complicated pregnancies. Most women who have been labeled high risk will see a perinatologist for their anatomy ultrasound. It's reasonable to ask if you need an additional consultation to discuss your high-risk pregnancy in depth, or if you should completely transfer your prenatal care to one of these specialists. Ask your provider if your medical condition may affect the timing of your delivery. Some medical conditions put the pregnancy at higher risk of needing to be delivered prematurely in order to protect your health. Most providers will recommend starting antenatal testing as an outpatient between 32 and 36 weeks for high-risk pregnancies. This helps evaluate the health of the placenta and reduce the risk of stillbirth. Some high-risk conditions, such as placenta previa, placenta accreta, or some multifetal pregnancies, will require a cesarean section to safely deliver the fetus. Ask your provider if your high-risk condition will impact what kind of delivery you will have. No matter what risk factors you face during your pregnancy, we are here for you at UC San Diego Health to provide excellent care and help ensure the safety of you and your baby.